Imagine waking up tomorrow morning and you can't say your wife's name. You know it, it's right there in your head, but your mouth won't make the sound. That's not a nightmare I'm making up. That's Tuesday morning for thousands of people every single day, and most of them had no idea it was coming. If you're over 40, and even more so if you're in your 60s or 70s, I need 5 minutes of your full attention because what I'm about to explain could be the difference between growing old on your own terms or growing old as someone your family has to take care of. Here's the thing nobody tells you about stroke. It's not really a die or survive situation. 2 out of every 3 survivors are left with a lasting disability, not a small one either. Speech that never fully comes back, a whole side of the body that stops responding. Some people spend the rest of their lives in a bed. Stroke has been the leading cause of permanent disability for years. And if you're honest with yourself, that's scarier than dying, isn't it? Becoming the patient instead of the provider, the one who gets taken care of instead of the one everyone leans on. That's the real fear sitting underneath this whole conversation. Now, here's the good news, and it's real good news. A stroke is one of the most preventable things in all of medicine, but only if you know where to look before it happens. So let's walk through exactly how a stroke forms, the 2 totally different ways it can happen, the simple tests that catch it years in advance, and the one deadliest version you want to make absolutely sure stays off your list. Think of your brain like a house, and blood is the electricity running through it. Cut the power for even a few minutes, and rooms start going dark permanently. That's a stroke. Part of your brain suddenly loses its blood supply, and the tissue starts dying within minutes. There are 2 completely different ways the power gets cut, and mixing them up is exactly why so many people never see it coming. The first way is a clog. A clot forms and plugs an artery feeding the brain, and everything past that blockage goes dark. This is by far the most common version. Doctors call it ischemic stroke, but just remember, clot. The second way is a burst pipe. A blood vessel inside the brain actually ruptures and starts bleeding. This one is much rarer, but it's far more likely to kill you. So really, these are 2 different diseases hiding under one name, and each needs its own fix. Let's talk about the clot first, because it almost never starts in the brain itself. It starts way upstream in the 2 arteries running up either side of your neck, the carotid arteries. Over time, plaque builds up inside them. But here's the twist almost nobody explains properly. Not all plaque is dangerous in the same way. Old, hardened plaque, the kind your body has calcified over time, is actually fairly stable. It's a sign of disease, sure, but it's not what's going to end your week. The real threat is fresh, soft plaque. Picture a blister, inflamed, unstable, ready to pop. When it ruptures, your body rushes in to patch the damage with a clot, and that clot can break loose and travel straight up into your brain. That's the stroke. Most people imagine a stroke happening because an artery has been slowly narrowing for years, like a hose getting pinched tighter and tighter. If that were true, doctors could predict exactly when and where a stroke would strike. We can't, because it isn't a slow squeeze. It's a sudden rupture, and nobody's watching for it. There is a test that can, though. It's called a CIMT scan, a simple neck ultrasound. No radiation, no needles, and it can spot that unstable soft plaque years before it ever causes the problem. That's one hidden source of the clot. There's a second one, and this one isn't lurking in your arteries at all. It's hiding inside your own heartbeat. Your heart is supposed to beat with a clean, steady squeeze. In a lot of men, especially as the years go by, the upper chambers stop squeezing properly and start to quiver instead. That's atrial fibrillation, or AFib for short. When those chambers quiver, blood doesn't get pushed out cleanly. It pools, and pooled blood clots. That clot can get launched straight out of the heart and up into the brain. Same result as before, a blocked artery and a stroke just a totally different cause. Here's what makes AFib so sneaky. It's often completely silent. Some men feel a flutter now and then. Most feel nothing at all, especially while they're asleep, which happens to be exactly when a lot of episodes strike. For plenty of men, the very first symptom of AFib they ever notice is the stroke itself. Risk climbs with age and climbs faster if you've already got high blood pressure, diabetes, or sleep apnea. I check all three of those boxes myself, and I live with AFib too, so this isn't theoretical for me, it's personal, and that's exactly why it deserves to be checked for on purpose instead of waiting around to feel something that might never announce itself until it's too late to undo. Now let's talk about the rarer, deadlier kind of stroke, the burst pipe. And it comes down to one number you could check from your own kitchen table every single morning. What makes this one so dangerous is that the thing driving it produces zero symptoms while it's happening. Blood pressure that runs high year after year slowly wears down the smallest, most delicate blood vessels deep inside the brain. Eventually, one of them gives out and starts bleeding inside the skull, a space with nowhere for that blood to escape to. Pressure builds up fast, pushes against the surrounding brain tissue, and the damage spreads quickly. High blood pressure is the number one driver of this kind of stroke, and it's the pressure itself doing the damage, silently, while you go about your day feeling completely normal. Maybe you're tired of hearing about your blood pressure at every checkup. Maybe you feel totally fine, so you tune it out. But that feeling of fine is exactly the trap, because underneath it, the setup for a stroke could already be underway. This isn't just about you either. It's about the spouse who wants a partner, not a patient, the grandkids who need you around, the community that counts on you showing up. So by now, you're probably noticing something. Clogged arteries, a silent, dangerous heart rhythm, rising blood pressure, three completely different problems that all seem to trace back to one shared root. And that root is how your body handles sugar. Every time you eat something that breaks down fast, white bread, white rice, sugary food, your blood sugar spikes. And every spike in blood sugar, every spike in insulin that follows it, fuels inflammation. Think of that inflammation as a low, steady fire burning along the inside lining of your arteries. That fire damages the smooth artery wall, and that damaged wall is exactly where soft plaque loves to form. It doesn't stop there. That same inflammatory process stiffens your arteries and pushes your blood pressure up too. In other words, insulin resistance, your body slowly losing its ability to process sugar, is the soil all three of these risks grow out of. Here's where most people get tripped up. They're watching the wrong number. A fasting glucose reading can look completely reassuring for years because it's one of the last things to go wrong. Even the American Diabetes Association, the group that recommends this test, admits it misses more than half the problem. Your fasting number can look perfectly fine, while the real damage is happening after every meal you eat, not before breakfast. If your labs came back normal and you assumed your metabolism was in good shape, that gap between what fasting glucose shows and what's actually happening in your body is exactly where this danger hides. Knowing all this only matters if you act on it. So let's get practical. Step 1, the step almost everyone skips. Test, don't guess. Your labs can look completely normal while damage quietly builds in your arteries. Ask about a CIMT scan to check for soft plaque. Ask for inflammation markers because most standard blood work leaves them out entirely. Check your metabolism properly by tracking what happens after meals, not before, using a continuous glucose monitor for a couple of weeks, an oral glucose tolerance test, or a fasting insulin panel, instead of trusting one single fasting number. Track your blood pressure at home over time, not once a year in a doctor's office. I'll be honest, I don't check mine daily either, but I make sure to check it several times a week. And past a certain age, ask your doctor about screening for silent AFib. Once you actually know what you're up against, you can fix it. There are three main targets. First, blood pressure. For most people at elevated risk, the goal is staying consistently under 130/80, and consistency measured regularly at home is what actually matters. Some people need to cut back sodium. Others, especially those already controlling carbs and exercising in the heat, might actually need more of it. Either way, dropping excess body fat, building healthy muscle, moving daily, cutting back alcohol, and getting real sleep all matter enormously. Untreated sleep apnea quietly drives blood pressure up too, and it can undo everything else you're working on, and you usually can't tell you have it because you're asleep when it happens. If someone close to you mentions snoring or breathing pauses at night, take that seriously and get checked. When lifestyle alone isn't enough, the right medication has some of the strongest evidence in all of medicine for preventing stroke. Second, atrial fibrillation. If you've been diagnosed with AFib and your doctor decides your risk is high enough, a prescription blood thinner is the proven way to protect your brain. I take one myself. I discovered my own AFib after noticing an odd fluttering feeling in my chest a few times, almost like something flipping around in there. I picked up an inexpensive handheld heart monitor, caught an episode at 3 a.m, and confirmed it. From there, I got proper care. For a while, my episodes climbed to roughly 20% of the time, which is high enough that an ablation procedure becomes worth considering. Instead, I lost about 10 pounds and tightened up my lifestyle, and those episodes dropped down to just a couple of times a year. Lifestyle change made a real difference for me, but I still take my medication seriously because supplements like fish oil or garlic, whatever you've read online, have never been shown to protect against stroke from AFib the way real anticoagulation does. This is a conversation to have with your doctor, weighing your stroke risk against your bleeding risk. And if it's recommended for you, don't brush it off. Third, your metabolism, the thread running through everything we've covered. The target here is simple. Keep your blood sugar from spiking above 140 after meals. Cut back on refined carbs. Eat vegetables and protein before any starches hit your plate. Honestly, consider cutting high glycemic carbs out of your diet altogether. A 10 to 15-minute walk after eating is one of the most effective ways to flatten a blood sugar spike. One of my patients told me he was at a family gathering, had a few carbs, then quietly slipped away and did 8 minutes of bodyweight squats in the restroom. That muscle activity pulled his blood sugar right back down. Building muscle helps because active muscle tissue clears glucose far more efficiently than your pancreas alone ever could. Sleep matters enormously here too, and losing visceral fat, the fat wrapped around your internal organs, rather than sitting just under the skin, makes the biggest difference of all. A proper body composition scan can show you exactly where you stand. When lifestyle changes aren't enough on their own, medications like metformin, GLP-1 drugs, or SGLT2 inhibitors can support the work you're already doing, especially as metabolic issues become more advanced. So what actually happens to existing plaque once you do all this? You're not going to scrub your arteries completely clean. Some reversal is possible, and I've experienced some myself, but full reversal isn't a realistic goal, and anyone promising to completely clear out your arteries with a supplement or a quick procedure is selling you something. What you can genuinely do is calm the inflammation, stabilize soft plaque so it's far less likely to rupture, and slow the whole process down dramatically. Caught early enough, you can even see real improvement. The honest, achievable goal is taking the risk off the table entirely, and that's within reach for almost everyone willing to put in the work. Before we wrap up, let's go back to the deadliest stroke of all. Deep at the base of your skull sits a small structure called the pons, sometimes nicknamed the lizard brain, because it runs the automatic functions that keep you alive without any conscious thought. Your breathing, your heart rate, your blood pressure. It's packed into an incredibly tight space with zero room to spare. So when a stroke strikes the pons, even a small one, there's no room for swelling and no margin for error. A pontine stroke is thankfully rare, but it's the one you least want, purely because of where it lands. And the single factor that protects it more than anything else is the same number we keep coming back to, your blood pressure. So that number you can check every single morning at your own kitchen table isn't just protecting you from the common stroke. It's standing between you and the deadliest one too. You don't have to figure any of this out on your own. If this opened your eyes even a little, do me a favor, hit like, subscribe so you catch the next one, drop a comment telling me which part surprised you most, and share this with someone in your life who needs to hear it. Because the person who watches this today could be the reason someone they love never has to become a patient instead of a partner. Take care of yourself, and I'll see you.